I mean, just from the word alignment, you should be aware that that's a really difficult thing to do. And I think what we've heard, I'm trying to not repeat what you've heard, but to build on it, but also to take a little bit of another angle here, because I think we've been talking about in a value-based arrangement, how do you make it work? What's the attribution logic? All of these different things. But what happens in the real world, right? Where you have providers that may have a health plan, right? So they're trying to get their delivery system aligned to their own health plan. And then they've got 3, 4, 10 value-based arrangements, all of which are slightly different. So they're trying to work their value-based environment to some degree. And then most of their business is still fee-for-service. And so I've bookended my career working in the provider-owned plan space, and I've been taken to task twice that what I was doing may be good for the value-based work, but for the fee-for-service work, not so much. And when you're sitting in front of a CFO that's responsible for revenue cycle, it can be an uncomfortable seat to be put in. So I think each of the panelists has a perspective. We spent a lot of time talking about this before we got up here, but I want to turn it over to them to talk about how they navigate that from the seats that they're in.
So I think it starts with trust. You heard that a lot today, so I don't mean to be redundant, but if there's no trust, you're not going to get anywhere at the end of the day. So it's really getting the right leadership team engaged and involved. And I've always seen that it really starts with the CEO saying that they believe in a value base and they want to drive that for their organization. So if the CEO is not aligned to that vision, that's going to be a hard sell because it's going to be really hard to get them away from a fee-for-service world. So you have the trust, and then it's, of course, data and analytics and transparency around that. And it's truly listening. So I know we talked a lot about attribution today. I will say, when you have an HMO product, a lot of your members have to have a PCP selected. And originally, at least at Priority Health and Corewell, together, we were not aligned on attribution. And there was that constant friction because we were using selected PCP at one point. And that was not usually who the utilization was through. So we changed our model. We listened to the Corewell primary care physicians, and we decided to change our attribution to be utilization-based. So we changed all of our algorithm. We made it sure we were very transparent. We said this is the membership that you're assigned to at the very beginning, and you can follow that every single month, who comes on and who comes off and what are the rules. So again, it comes back to the data, the analytics, the transparency, and the trust, and listening to each other. That's where I would begin.
I think I mentioned to Bob earlier, I'll probably have more questions than answers as a panelist here, but as I think I have a very different experience maybe too with our provider-owned health system. The trust is one thing, but also the partnership is kind of a slightly different thing. That's something that we've struggled a lot with, is feeling like we're actually playing on the same team, bringing like collective strengths to the table. Conversations still feel, even within under our own umbrella, contractual and transactional, like instead of kind of figuring out how do we solve a problem together. We're sort of in the middle of the, thinking and deciding what this should look like phase in a new contract with a provider system, of trying to figure out how we could do something like that. And I think someone else mentioned something like this earlier, but one of the big things was sort of putting our financial model on the table. And so starting with transparency, like how do we make money as a provider? How do you make, or as a payer, how do you make money as a provider? And like, how can you figure out the economics of like how to make this work? Who's better served to own different pieces of it? We're kind of starting to go down that path to see if we can see if there's more of a win-win type situation. But it's such a challenging thing to get out of those, like we're playing on separate teams mindset.
I think for me, and I might answer the question a little differently, but some of the challenges. So when I started value-based care, let me say it differently. When I started work at the hospital, I used to go to the bed board first thing every morning to see if we had a full house. Because I thought if we had a full house, we're going to make our budget this, and everything's going to be great. When I was pegged to help start our value-based care company, I would go to board meetings and I would explain to the board, we're really doing good on these value-based care contracts. We've lowered admissions, our ED utilization down, like my CFO is sweating. Like how is this good for me? To Bob's point, I do think that we as a society have to figure out what is the fundamental purpose of value-based care. I was always thought that the healthcare system was broken and too expensive, and so we're trying to lower cost. Everybody wants to take the same piece of a big pie and do something with it. I do think as a society at some point we have to figure out what are we going to do to solve the healthcare crisis, and I think alignment of business models is part of the challenge that keeps us from getting there.